Purpose of Pediatric Nurses by Janice Aramis. Have you ever thought what the world would be like if there were no nurses? Specifically, if there were no pediatric nurses. How do the children benefit by having these nurses that are specifically designed to help them? How do the parents benefit by having these nurses that help their children? By the end of this speech, I hope to give you a new outlook of how these nurses are vitally important to our society. Pediatrics is generally seen as the easy route in the medical field. Why, you may be wondering? Well, typically doctors don't like to work with children. They tend to think that working on adults is much harder than working with children, when in actuality it's not. Children are much harder to deal with as they provide a different amount of emotions as they go through these trials. The nurses are the ones who deal with these cases. The nurses are the backbones of pediatrics. Not only is their job to monitor these young children through the hospital, but also comfort the parents to understand what's going on around them. This topic has gained my interest as I have chosen to choose this career, pediatrics nurse practitioner. I have gained the information over a course of a few months to make sure that I'm properly prepared for this speech and for my career. The main points that I would like to discuss with you about this speech is how the pediatric nurses help the children, how they can help the parents, the downfalls that they go through, and how they are vitally important to medicine. My first main point is that the nurses help the children feel secure in many ways. Now, the nurses try to make sure that the children are their top priority. They want to make sure that they feel that they are cared for and that they treat them with kindness. To each child, they must treat them differently, but make sure that they always feel secure. They must always communicate with them. Communicating with children is much different with communicating with adults, especially for a pediatric nurse as they deal with a wide range of different ages. They must know how to communicate depending on their age. In short, the nurses help them feel secure by making sure that they are their top priority and by communicating to them. My next topic is how they help with the parents. You see, while these children are being brought in, the parents are watching their children go through misery. So the nurses must be there to support them and make sure that they are mindful of what their parents' mindset must be. The nurses must comfort the families and prepare them for the possibilities of the patient. They must communicate them with constantly. They must bring them updates and let them know how their child is doing. In short, they help the parents by making sure that they are communicating with them and making sure that they know what's going on. The next topic is that there are also many downfalls to becoming a pediatric nurse. When you're a nurse, you get to deal with children, which is the most beautiful thing. But along with that, you have to work a lot of hours. Nurses must work at least 36 hours a week, and they can also work overtime. You see, when you're working with children, you tend to form a bond with them. And when you form a bond, they want you there because they know that you care for them and that you're willing to protect them. So most pediatric nurses like to work overtime to make sure that those kids are taken care of, especially by them. But that puts a lot of exhaustion on them, physical exhaustion. Along with this also comes emotional exhaustion. What I mean by emotional? Well, while you're dealing with these children, like I said, you form a bond. You take care of them. You make sure that they're taking their meals. You make sure that they're getting their medicine that they need to have. You get to see them grow up. You get to be with their families as they go through these trials. Sometimes you get to be happy and see them go home, but also sometimes you have to see them go through misery and watch them die. And you have to be support for the family. But as you're doing that, because of that bond, you're also feeling sad, because that's a person that was a close friend to you that you have lost. And that can cause emotional exhaustion for them. In short, as wonderful as it is to be a nurse to deal with kids, there's also things that you have to go through that you don't want to. My next topic is that pediatric nurses are a massive help in the medical field. Yes, the doctors are the ones who deal with the patients, who give them the diagnosis, who prescribe them medicines. But as I said before, the nurses are the ones who take care of them, the ones who are there to comfort them, the ones who are always there to talk to them. The nurses must always be in a constant chipper mood because that's what helps them get better. The happier the patient, the better they'll get. They're always on constant surveillance on both the child and the parent. The nurses have many duties that they must do, and while they're doing these duties, they have to make sure that they're watching the parent, they have to watch the kids, and they have to keep constant updates to the doctors. In conclusion, pediatric nurses are of huge importance to medicine. They have impacted so many lives and touched so many hearts that these people are happy now. I hope that you understand that these nurses work their lives to make sure that these children and these parents are taken care of while they're at the hospital. Thank you.